Hello, my name is Dr. Troy Jakes from the Twin Falls Upper Cervical Clinic. Today I have Heather with me. Heather is, how far along are you?
22 weeks.
22 weeks pregnant here. Congratulations, by the way. Thank you. We do see several pregnant patients in our office, and I wanted to kind of explain a few things on how we help our pregnant patients in our office. First of all, we do make sure that the nervous system as a whole is working properly, and that being said, we do that by making sure that the brainstem is working right. We make sure that the atlas, the top bone of the neck, is properly aligned so that there's no interference with the nervous system. However, I understand that does not take care of everything under the sun. That is why we are going to go into some more details today about how we take care of the rest of the issues that a pregnant person might have. Okay, so research has shown us that women under chiropractic care can reduce their labor and delivery time by up to 25%. That's a huge number. If we could, make delivery a whole lot better for mom, that's what we're going to try to do for you. Okay. Throughout the different trimesters here, we have different issues that can occur. Obviously, low back pain is a big thing here. As we get into the second and third trimester, we actually get a lot of carpal tunnel type issues here in the wrists and the hands. That's not very pleasant. At the end of the first trimester, that's when relaxin, which is a hormone, that peaks at that end of that first trimester here, and that hormone is exactly what it sounds like. It relaxes all the all the other muscles, the tendons and the ligaments here. Obviously, mom has to change her body to allow the baby to be born, and when all those changes are occurring, then we get other misalignments throughout the body here. We get joints that don't work properly here, and I want to kind of show how we can avoid and overcome some of these other obstacles. One of our favorite things we like to use for our pregnant moms here is the bouncy balls. It's going to really help with the muscles and the core muscles. It help with the low back pain here. So I'll just have you have a seat here for me here, and so what you kind of want to do here, just like you're doing here, you kind of gotta have a wide base with this so you can stay straight like you are. When you're sitting in a chair, what happens is you like to tend to, and we all do, we all kind of slouch here. And when we slouch, that doesn't do anything to help these muscles in the low back right here. And so you don't really want to sit too close like this here because then you lose your balance on this here. But you don't want to be like uncomfortable out like that. You want to have a nice wide base here, and that's going to help strengthen the core muscles. So anytime you have a chance to just sit and relax on the just in your life, use this here to unwind for a few minutes.
Okay.
The next thing that commonly occurs is we get a lot of groin and pelvic pain here, and what happens is the muscles from the inside of the leg here, they do connect up into the pelvis here, and as that occurs, that's going to cause a lot of tightening in these groin muscles here, and what that'll cause is restless leg syndrome. Do you ever experience any of that?
Oh yeah, a lot of that.
Not very fun, is it here? Alright, so this little tool, it's a little roller pin here deal, and less than $10 at Walmart, I believe is what it was here. And this is something that you can use, have your spouse do when you're not in the office here. But the big thing that we like to do here, I'm going to just kind of move your leg out just like this a little bit here. And just, it's very simple, just like this here. We're going to get in here, and we're going to roll it in just like that here. We're going to do that a few times there. How's that feel to you there?
It smells pretty good.
Yeah. Good deal. So you're going to want to do this for about 5 to 10 minutes here. It depends on how bad it is like that here. And you're always going to want to start from basically the knee and move upward towards the heart. You're trying to get the blood flow through the circulatory system, through the heart better here. All right, so after you do that for a few minutes here, this little tool you can use honestly whatever. If you want to just use your own rolling pin in your drawer, you can also use a soup can. Anything that gets into those muscles like that, that's going to help mom out a whole lot here. Did that feel better?
Oh yeah.
Yeah,
A
okay,
lot better.
perfect here. Obviously you're gonna wanna do both sides here, but that's gonna help with this restless leg syndrome a lot for you here. The next thing that happens is we have a ligament called the round ligament here. And basically the round ligament is a ligament that goes into the pubic symphysis here, and it goes over to the top of the iliac crest over here. Somewhere right in here, and I don't know, did I feel it, find it there? Yeah, okay. So it's a little like a pea size, almost like feels like a pea underneath the ligament here. And sometimes that gets really tight, doesn't it? Yeah. And so what we do is we just kind of, it's almost the same concept here as getting that worked out here. So you, as mom, you can just get on that and just kind of hold that one spot right there until it kind of dissolves here. And you're going to want to do it on both sides here. But so you just kind of get on it, just kind of hold it tight for just a little bit here. And then after, you can kind of move your thumbs away just a little bit here, like that here. And that's going to really help loosen that up here. Obviously, with all that relaxin, that hormone going through your body here, you don't want to do anything too forceful. You need to understand that, yes, other injuries could occur if you are too forceful with any kind of adjusting or overdoing anything at this point in time. As we progress through the pregnancy, that hormone relaxin is relaxing everything, including the pubic symphysis right here. A lot of times we're told we should do lunges to help strengthen everything with the muscles, tendons, ligaments. I'm going to disagree with that here. When we do those lunges, that can misalign the pubic symphysis, and that can cause a lot of pain right in the middle of they call it lightning crotch is what it's called, and it just causes lots of pain. Have you ever experienced that before?
Yep.
Not very fun, is it here?
Nope.
And then we got to go in there and readjust and do some things like that if we have to here. So try to avoid doing lunges as much as possible here. But here's the deal, Heather, do you have other kids, right? You got a couple other kids, right? And so a lot of times what happens is you're probably playing on the ground with your little ones here. And I want you to understand how to get up from this position, because this is kind of a hard position to be in here and get up here. So go ahead and have a seat for a second here. But what I'm going to do is I'm going to show you how not to do it and then how to do it here. So if you're playing with your other kids like this here, a lot of times when you're done, this is how we all normally get up here. We put one leg forward, and that really stretches out that pubic symphysis here, right here. And that's going to even put more strain and stress in this area, and we want to avoid that as much as possible, because then you step like that and that just really stretches that out and it becomes very uncomfortable. So let me show you, Heather, how we like to have you get up when you're in this situation here. So instead of doing that, what I want you to do is come up onto all fours like this, and then you're going to just walk your legs back like this and stand up like that, right there. And that's going to take a lot of strain off of the pelvis right there.
Fantastic.
Later on in the pregnancy, a lot of times women get carpal tunnel symptoms here. It can be a misalignment in the carpal bones right there, and obviously if that's the case, a trained professional chiropractor would need to go in there and realign those bones properly here. What happens though is it becomes a vascular problem. Your blood is going to the baby here and not going down your arms like it normally does here. And that's going to cause some of that numbness that you do experience in the hands right there. And so we want to try to keep as much blood going through the rest of your body as possible here. So what we like to do here is, if once this is in the right spot here, a good little exercise to keep you going strong without causing those other problems is just kind of holding your hand straight like this and pulling your hand back like that right there. And you're going to hold it for 10, 15 seconds, something like that here. And then you're going to relax, and then you're going to change hands just like that. You're going to hold it for another 10, 15 seconds. And I would recommend doing that probably 2 or 3 times back and forth like that. And I do it probably twice a day, usually morning and night. And that's going to help keep the blood flow, the nerve flow going throughout your hands and keep the numbness out of the hands. All right, Heather, did you learn anything today?
I learned a lot that'll help me make this pregnancy a whole lot easier than my last ones.
Awesome, very good. So here's the deal. We want to make sure that the central nervous system is working at its peak performance here. On top of that, I want to give you some tools so you can make this the best pregnancy you've ever had here. The ball, the foam roller here, how to get up, what not to do, what to do here. And this was just a short list of things that happens during pregnancy. There's obviously much more that we can discuss as things arise here. However, if you're pregnant and you're struggling and want to have a better pregnancy here and reduce that time down to, reduce that time by 25% of the labor and delivery, give chiropractic a try. If it's time, call the office at 208-352-7833. Thanks a lot.